Hello, I'm Matthew Weinstock with Hospitals and Health Networks with continuing coverage of the Health Forum American Hospital Association Leadership Summit. I'm joined right now by Joseph Betancourt, who is the director of the Disparities Solution Center at Mass General Hospital in Boston. Mass General was the first recipient of the AHA Equity of Care Award, which was inaugurated this year. So Joe, thanks for being with me today.
Oh, it's my pleasure. Certainly honored and humbled by this award.
So Joe, Mass General has been involved in pursuing equity care and diversity issues for quite a long time. It's really become an organizational priority. Can you talk a little bit about how that became?
Certainly. I think for us, we're very fortunate in that we have leadership who's been very committed to the idea of equity and really the basic principle of making sure that we deliver the highest quality of care to any patient who enters our doors, regardless of their race, ethnicity, culture, or class. I think the beauty is that I spend a lot of time trying to make the business cost and quality case to leaders around the country why they should tackle this issue. I think we're fortunate in that our leaders believe this isn't just the smart thing to do, it's the right thing to do.
And you guys, as I said, have been focused on this issue for quite some time. You've been collecting data on equity of care and diversity and disparities since the 90s. You issued your first report on equity and quality of care in, I believe, 2007. What are some of the things you've discovered over the time of collecting this data?
That's a great question. We've been committed to this issue of diversity for quite a while, and I think a real turning point for us was the Institute of Medicine report on equal treatment that was released in 2002. I think we fortified our efforts in data collection there, and I think the idea for us was that we wanted to make sure that we were collecting key data to monitor our performance. Just like we monitor our performance in quality or in safety in other areas, again, we wanted to make sure that we were delivering on our promise of quality to every patient we care for. What's interesting is that our data is a mix of great news, but also some bad news that we feel we should be committed to addressing. So in a lot of areas we have equitable care, areas like the management of patients with heart attack or heart failure or pneumonia, inpatient situations where we're in control of the patient and we're able to partner with them, they're under our watch, we tend to perform very well, as do hospitals across the country. I think we've tended to see more disparities in the outpatient setting where patients are more at the discretion of their social environment. That being said, we've tackled these disparities that we found in both diabetes as well as in colon cancer screening. So I think there is definitely evidence that these issues can be identified, addressed, and these disparities can be eliminated.
So as you said, you've had some good news and bad news in what you've done. The Institute for Diversity in Healthcare released its report last month that showed little progress across the field in terms of diversity and equity of care. I'm wondering if you could speak to the field in terms of what they should be doing, maybe steps 1, 2, and 3 for those that aren't collecting data as robustly as you, and more importantly, how to use it. Where should they start?
Sure, that's a great point. I think the Institute has demonstrated that we see a smattering of progress around the country, but I think nowhere as near as what we'd like to see. And I think the bottom line is that organizations that are taking action very clearly see the connection between disparities and equity to cost, quality, safety, and value in healthcare. So I think what's going to separate the winners from the losers going forward, in fact, is how effectively we care for vulnerable populations and how we meet the needs of diverse populations. I don't think it's just about collecting the data. The data is certainly the foundation, but again, it's monitoring performance, identifying where we have gaps and addressing them. That's standard quality improvement, and I think we're trying to, through work that we're doing at our center and the Disparities Leadership Program, work with hospitals around the country who are interested in making this progress. We don't need to reinvent the wheel. There are great models out there, and I believe that we can, on scale, make a real difference on this issue.
Well, great, Joe. Again, congratulations on the award, and thanks for taking some time with me today.
Thank you so much. I appreciate it.
And I'm Matthew Weinstock with H&HN. We'll have more coverage from the Health Forum AHA Leadership Summit in tomorrow's H&HN Daily. Thanks for tuning in.